Welcome to this video version of the BC COVID-19 Modeling Group Report being released on July 28, 2021. I'll cover the highlights of the group's analysis over the last few weeks, including the ongoing impact of reopening vaccinations and the rise of Delta. So first, a quick reminder of who we are. The group consists of academics from University of British Columbia, Simon Fraser University, and University of Victoria, as well as a few associated individuals. And between us, our expertise covers the range of data analysis and modeling and epidemiology and related areas. We are independent of the BC government and provide an independent voice to supplement the efforts of the BC CDC and within the government itself. So here are the key messages for the report. First, as you likely know already, COVID-19 cases are now rising in BC as a whole, and as I'll show in a couple of slides, most concerningly in the interior health region. From the analysis I'll present, there's some evidence now that we'll be entering a phase of rapid growth, and case numbers will really need to be watched carefully. Delta continues to rise in frequency relative to the other variants, and in fact is now rising in absolute numbers as well. So we continue to collect data that shows the impact of vaccination, and what we see is that in communities with lower vaccination rates, we're seeing as much as 5 times as many cases as in those communities with higher levels of vaccination. So we're observing too that vaccination rates are inching up slowly now, about 1% per week. So this suggests that we might not make it much higher than we're at right now. And this point and the previous one highlight the importance of the government's press conference, for example, yesterday on vaccination and some of the initiatives they're taking to try and increase vaccination. So vaccinated individuals can still catch and transmit the virus, even if it's at lower rates than those that are unvaccinated. Some level of caution, masking indoors, distancing, etc., is still warranted despite the softened messaging on these issues from the government. Not only can vaccinated individuals get infected and pass it on, they often do so asymptomatically, which makes, for example, contact tracing, still an important tool in keeping the virus under control, much more difficult to carry out. Here we have Jens von Bergmann's current summary of the state of the COVID-19 pandemic. So one of the notable features here is that that third wave peak, which led after the lockdown or the circuit breaker, led to a long phase of decline. We've finally reached the end of that with reopening July 1st, or possibly the introduction of Delta, or the beginning of growth of Delta. We're now seeing a turnaround in that trend, and this upturn here is mostly driven by what's going on in the BC interior. So here's Jens' analysis breaking out the daily cases per 100,000 population. So these are all normalized, and what you can see very clearly is that on a per capita basis, the growth that we're seeing in the interior is quite a bit more dramatic than what's happening, if there's anything happening elsewhere in the province. And so here's just a few notes on what's going on with vaccination. So there's a few reasons why this rapid growth could be happening. One of them is that the interior has among lower, not lowest, but lower vaccination rates in the province. There's also the question of whether Delta is driving this, and why it should be more so in the interior is not clear. And just anecdotally, from a recent trip to the interior that I took a couple weeks ago after July 1st, it was very clear that Vancouver and the Okanagan are treating the July 1st lifting of measures very differently. We're still seeing masking in grocery stores and servers at restaurants here in Vancouver, but masks have largely, at least in my experience, disappeared at grocery stores and among servers at restaurants or bars in the Okanagan. So let's go on with a little bit of analysis of what's happening using the modeling. So here is Dean Carlin's his fits from June 16th This is just looking at the old data and his fits to it. And the remarkable thing in almost all the health authorities, except for this brief burst here, which is a bit of an anomaly, is that he found no breakpoints from the end of March or beginning of April with the introduction of the circuit breaker sort of lockdown until now. There have been really no change in parameters. So that includes the end of May and mid-June lifting of measures. And finally, in July, we're going to see soon in the slides here that there is some final change happening now. So let's just zoom in at the tail end. Here, Dean has added in blue to those same plots the more recent data. So this is the data that was used for the fitting in green, and the green curve is the fit, and he's continued that fit out here, which is kind of hard to see. But you can see now that the blue finally around the beginning of July here is starting to deviate in all health authorities, some more dramatically. There's in the interior, but across the board there is an upward stroke. And here, so just a reminder that a log plot is a good way of zooming out for high values and zooming in. So it's kind of a graded magnifying effect. And so we're going to do that here to see a little bit more clearly what's going on at low case numbers down here. So you can see that across BC there's this upstroke, which is echoed in most of the health authorities pretty clearly and very dramatically in the interior. So just to look at what's going on in some of the other provinces, you can see that the same phenomenon was happening in Dean's predictions through May and June in Alberta, Manitoba, Ontario, and Quebec. And you can see now Alberta is just in the last little while, the last week or so, rising above those predictions. But Manitoba and Ontario and Quebec are closer to it, but actually, Manitoba and Quebec are maybe deviating, but not so much as what's going on in BC, interestingly. So Dean has been doing a lot of analysis of what's going on in various countries in Europe as well as in the United States. He's actually done some analysis, I think now, for all 50 states. And he's pulled out here an interesting case that is typical but a lot more clear. So that's the one he's chosen to use to demonstrate what we think might be going on, or what he's proposing might be going on with the recent change. So this is a little bit different from his usual model. What he has here is no breakpoints, and he's just assuming that there was an alpha strain decaying with some unknown decay rate, and delta is now starting to grow with some growth rate. And he leaves the transmissions rates for each of those two phenomenon as parameters and fits those to the data. And what he finds for Italy is that alpha was decaying at about 8% per day, and delta is now increasing at about 12% today, representing a 20% per day swing. Now, he doesn't have any breakpoints in here, and when we talk about BC in a moment, we kind of know that there should be a breakpoint right here at the beginning of July, because that's when measures were lifted. But that could be absorbed just because of the coincidence of the rise of delta with those July 1st measures. This could represent, this 20% per day in Italy, but also in BC, more importantly, could represent the onset of delta growth and combined with what's going on with the change in measures. So let's take a look at what's happening in BC with that same approach. What you see here is a 9% per day decay leading in alpha leading into July, and delta appears to be growing with a 9% per day, representing an 18% swing. So just keep in mind that this 18% per day swing, that's actually, if this truly was all about delta and not about the lifting of measures, that would be an estimate of the selection coefficient, that is the difference in growth rate between alpha and delta. And Dean's estimates of that, which I think we have a slide on that in the appendix, I won't talk about it, but I've talked about it previously, is that percentage is more like 10%. So it seems to be that this approach is at least partly missing what's happening due to opening. So this 18% could be a combination of an increase in transmission due to Delta, but also an increase in transmission due to the lifting of measures. Now, if these fits really are correct, and we may want to see a little bit more data before this line is really completely certain. But this growth rate represents just about the fastest growth that we've seen at any time during the pandemic so far. So this is kind of a concerning phenomenon that's going on in the interior, but also we're still seeing growth everywhere in the province now. So that's all kind of concerning. In this slide, we see Saliato's analysis of the growth rates of the various variants that we currently have in BC. Here, what she's done is she's just limited the scope of the data so that it's through a period where the situation has been a little bit more constant, shorter time interval. And what she's finding is that alpha and gamma are still decaying. The other variants not named here, there seems to be some growth there, but we're talking about very low numbers, so this isn't really a concern. And Delta, there's a point estimate that has a positive growth, and the interval just dips below zero. So it seems fairly likely, but not absolutely certain at this point, that Delta is now growing. So that tells you that some of the analysis I talked about earlier with what's going on in each of the health authorities with the uptick, that uptick may be partially due to Delta, but also probably due to reopening. So here, we're going to return back to data from Alberta, and the idea is to estimate a Canadian selective advantage and growth rate for Delta. So what you can see here is Saliato's analysis of the ratio of Delta cases to alpha cases in Alberta, and when she fits, she gets a selective advantage of Delta of about 10% per day. Remember back on those slides from Dean's analysis, we were talking about seeing like an 18% per day swing. So what this suggests is that 10% of that swing could be explained by Delta, and the rest of it is if I'm trying to be self-consistent through all these analyses, would have to be explained by the reopening. And she's finding also an absolute growth rate of Delta of about 8%, just shy of 8%, which has a doubling time of just a couple days beyond a week. Okay, so this slide is emphasizing what's going on in hospitalizations right now. And from the graph, it's a little bit subtle to see, but the point is that if you look early on in the year, you can see that the darker blue shades, which correspond to the older age cohorts, have a larger span over here than do the younger cohorts. And if you follow this line across, you can see that the fraction of hospitalization cases that are in the older age cohorts have shrunk, and those from the younger ones have grown. So this is likely due to the fact that the elderly are getting vaccinated first and more completely at this point. And this is really a strong message, I'd say, to everybody who's only had their first dose, that getting your second dose, even if you're young, is still an important thing to do. So yesterday, Dr. Bonnie Henry mentioned that the focus is going to be not so much on cases, but on what's happening in the hospitals and ICUs. So we're expecting growth, but what we want to know is if the hospitals and ICUs are under severe pressure. So this is Dean's model with the same hospitalization and ICU occupancy rates that have been fitted for the last couple months. And what you can see here is that as cases rise, if they continue to rise as they have been in BC, this is the hospitalization and ICU occupancy data that we would expect to see. So notice that The turnaround in cases happened already sometime in the first week of July, but according to Dean's model predictions, the ICU and hospitalization turnaround is not really expected to be noticed or visible yet in the data, and this is already a couple weeks later. So cases are still functioning well to predict what's going to happen in a couple weeks with hospitalizations. Also notice that hospitalization and ICU data is now rising above the predictions. This could be because of an underreporting of cases or due to long-term hospitalizations, which are more common now than they were earlier in the pandemic. Now let's take a look at how vaccination is progressing. What you see, as in previous reports, we've got the circle of 100% vaccination. So all the way around this circle indicates an age cohort is 100% vaccinated, and in red shades, those are the first dose progress bars, and the green are second dose. So what you can see is the green, there's lots of light green, which indicates that these age cohorts are getting rapidly second dosed, and a lot less is happening here in first doses. We estimate about a 1% per day increase on average in the first dose across the age cohorts. And just looking globally, sort of averaging across these age cohorts, we have these black lines here, and the fact that 9th, 16th, and 23rd of July are all pretty tight shows you just how much the first dose vaccination has slowed. But you can see here that second dose is spaced out nicely, meaning we're moving more quickly in the second dosing, and hopefully these will wrap all the way around as far as we can get them to get as close to herd immunity as we can. So this slide is a continuation of data that or an update of data that we've already reported on. So this is looking across community health service areas, so identifying the vaccination percentage in each of these service areas, and then plotting the average daily cases per 100,000 on this axis. And when we do a fit to this data, you can see it gives us a clear decreasing slope. And if you look at around 70% vaccination, you get a number that's just above 2. That's 2 daily cases per 100,000. As we get up to a 90% vaccination, that's gone down by less than a quarter, or about a quarter of a case per 100,000. So that's a factor of 5 decrease. So clearly, vaccination across a community is having an influence on the propagation of infections. So this is a new analysis introduced by Sally Otto. So she asked the question of what fraction of cases are of unknown source. So what we're seeing is a gradual increase in the fraction of unknown sources for any given infection, and the most obvious interpretation for this, we think, is that because vaccinated individuals are more likely to be asymptomatic, the contact tracing is more difficult, and that means that as we see more vaccination, it'll be harder to identify where those infections are coming from. But they're still able to transmit to others. And so the point here is that the efficacy of these vaccines is not 100%, which means that vaccinated individuals not only will be able to get infected and possibly spread it, even though they might be asymptomatic. So this is really one of the arguments in favor of continuing to mask even when fully vaccinated. The idea is that you help protect others by sort of incapacitating the spread, this invisible spread, through the vaccinated population. Okay, so now just wrapping up with our final messages. So we have seen recent growth in cases, and that's predominantly in communities with lower vaccination rates, especially in the Interior Health Authority, which is seeing rapid growth. Delta has been rising relative to the other variants, consistent with a 10% per day growth advantage over Alpha. The growth in Delta cases has been extremely rapid in many other jurisdictions across the world, and we're starting to see early signs of that happening here in BC. So while the risk of catching and transmitting COVID-19 is lower once you're fully vaccinated, there still is a risk, and this risk comes along with it the possibility of transmitting to other people without really being able to track it. And so our recommendation is to continue use of masks when possible indoors, reduce exposure to poorly ventilated and crowded indoor environments, and a continued push for vaccination among those who have not yet been twice dosed or even once vaccinated.